Good morning, everyone. My name is Dr. Rachel Owen. I'm the director of Missouri Science and Technology Policy Initiative, or MOST Policy Initiative. We're a nonprofit organization based in Jefferson City, and we aim to bring scientific resources to policymakers. So we have fellows who are placed at the Capitol. They work with lawmakers side by side to advise on scientific resources related to bills. And then we also have events like this where we try to bring some other emerging topics to the attention of lawmakers, things that are pressing around the state of Missouri. So we're really excited this morning to have our briefing that's focused on agriculture and natural resources. Our fellow Dr. Eleni Bickle planned this, and so I will go ahead and turn it over to her to introduce the briefing.
Good morning, everybody, from me as well. I'm Dr. Eleni Bickle. As the Agriculture, Natural Resources, Conservation, Economic Development Fellow, I get to work on complex issues. Some of them are very interesting and help farmers. Some of them try to prevent problems from happening. This is one of the issues that really is transcending across the issues that other fellows are working as well. So I'm excited to have three experts on the topic of mental health for farmers today. Just to give a little bit of introduction for our participants about the topic, American farmers produce nearly all of our country's food and contribute to about $133 billion every year. However, farm life can be demanding and stressful, which is something that some of our experts are going to talk about as well. According to data from CDC, individuals who work in agriculture, forestry, fishing, and hunting are among the top 5 major industry groups that have the highest suicide rates. Moreover, because of COVID-19, we only anticipate that these problems have been exacerbated and that farmers and their families are in need for more help with the stresses and the mental health issues that they may be facing. During this briefing, we're going to be able to hear from Dr. Michael Rosmann, who is an expert in the topic. He's an Iowa psychologist and farmer. He lives in Western Iowa and has spent over 30 years seeking ways to advance regional and global food production policy, which enhances the behavioral and economic welfare of the food producers. He maintains stewardship of the land, to maintain the stewardship of the land and other resources used in food production, and he wants to be able to protect the mental health and kind of reduce the barriers of accessing these resources that farmers can get. We will also hear from Professor Kathy Doherty, who is an MU extension researcher, and she does work with the Missouri Agriability Project. Last, we're going to hear from Jason Meadows, who is a pharmacist, farmer, and a speaker on mental health issues in Missouri. He has a podcast that is called The Ag State of Mind, and through that podcast, he tries to reach farmers and others in rural America regarding the mental health crisis surrounding agriculture. And with that, I'm going to turn it over to Dr. Michael Rosmann, who will specifically talk about the barriers and the problems that we have right now in the mental health state in the US and some other policy aspects of the issue. Dr. Rosmann, let me share my screen and your slides here in a second. There you go.
Great. Are we ready to go?
Yep. Do you see the big slide? Okay,
yeah,
perfect.
Looks good. Well, thank you, Dr. Bickle, for your introduction, and it's a pleasure to have this opportunity to provide some background information about the behavioral health of the agricultural population. I intend to provide some broad strokes about what is going on in the mental or behavioral well-being of farming people around the country, and specifically in Missouri. I have worked for about 40 years with the farming population. My wife and I left positions at the University of Virginia, where I was a professor in the Department of Psychology, to return to the land. So we live on a farm that is only 1.5 miles from where I grew up. Over the course of time, I went through the farm crisis of the 1980s, began doing research on the agricultural population and their response to economic threats and other kinds of stressful issues. We have about 15 years of dedicated experience serving all farm people who requested assistance in Wisconsin, Minnesota, North and South Dakota, Nebraska, Kansas, and Iowa. And I'll describe some of that research because it gives us some baselines that we can perhaps implement in Missouri and in other places around the country. Why is it important that we address the issues of farming and rural people? Well, it's because the number of professionals, especially psychologists and psychiatrists per 100,000 persons, is half that of metropolitan areas in most parts of the farm country of the US. It's similar in Missouri. So there's a shortage of professionals to meet the extensive needs that the farm population has, along with the needs of their rural communities. It is no surprise, perhaps, to all of you in Missouri that every Missouri county except one is designated as a mental health shortage area in 2021, according to the Office of Rural Health Policy, which works in conjunction with the state offices of rural health around the country. Missouri is not the only state with that kind of situation, though. It's pretty endemic in all of the Midwestern and Western states of our country. Next slide, please. The behavioral well-being of agricultural people is really key to producing sufficient food. I like to think that farm people are the most important asset in the food chain from producer to consumer. I like to use the term behavioral health partly because the term mental health is so loaded with negative stigma. It's something that we hear bandied about. For example, in high school, we'll hear kids say to one another, "Oh, he's mental." You can't do that with the term behavioral. In addition, farm people are very very knowledgeable about the behavior of livestock and even their own well-being. We've come a long ways, especially in the past 25 years, and farming the term behavioral health has become more acceptable. It is something that we can now talk about. Prior to COVID, it was common for farm men to give each other a hug. Who would have guessed that would have happened? In my local community, the coffee shop farmers, every Monday prior to the COVID outbreak, they would meet and then somebody would bring in a copy of an article in a farm news publication or one of the magazines, or it might have even been a column that I have written. And they'd say, I wonder what Rosmann's got to say about us now. And they would talk about behavioral health and depression and how they were feeling in ways that you couldn't do 40 years ago, but it has become more acceptable now. It is important for us to realize that our behavior is one of the few factors that we can control as agricultural producers. We certainly can't control government policy or the weather or consumer preferences and so forth. Next slide. The behavioral health practices or that have been determined as most beneficial somewhat come from the research that my colleagues and I have undertaken for the past 15 years or so. We looked at what were the best practices that emerged from the farm crisis of the 1980s. We met together, that is, representatives from the 7 states that I mentioned met together several times to figure out, if we could, what would work the best to support farmers who are struggling with stress issues, even suicide. We did a careful analysis of 43,000 plus telephone calls to hotlines during a 26-month dedicated period. That is, we studied this 26-month period very carefully. Of the 43,000 callers to our hotlines and helplines, we found that approximately 7,000 went on to obtain professional behavioral health counseling that was furnished free of charge, like an employee assistance plan. We found that after participating in professional counseling when necessary, 91% of the participants who were farm people said they would recommend this approach to other persons who needed assistance. We found also that community workshops were essential to building good relationships with others in the community, such as the business partners within a community, church, behavioral health care providers, the educational systems. And we found that the best services were those I should say, the way that services could be promoted most effectively was through radio, newspapers, magazines that farm people read or attend to, and now through the farm service agencies that exist in every highly agricultural county. So best practices that emerged from our research are the development of farm crisis telephones and hotline services. They are advertised through the FSA. There has to be a provision of counseling that is affordable. There must be a capacity to bring together experts within the local community to help the marginalized or distressed farmer, and community workshops that are often provided during the winter months have a big role in making mental health and behavioral health acceptable. The next slide, please. These best practices became the foundation for the current Farm Bill, Farm and Ranch Stress Assistance Network. The Farm and Ranch Stress Assistance Network is a federal program funded through USDA. It's in its 3rd year. There is funding available to the amount of $10 million annually across the country. That's not nearly enough, but it's a start. And when you combine it with state resources and other private funds like, let's say, farm businesses and corporations, farmer organizations, such as Farm Bureau Federation, soybean growers, Iowa, or National Corn Growers Association. When we put together that combination of federal, state, and private funding, we can do something that really helps to build a network of crisis supports for farmers in trouble. There are 4 regional centers around the country that are dedicated to helping local entities and states to develop their own resources within their states. The Midwest Regional Center first was at Iowa State University, has now transferred to the University of Illinois at Champaign-Urbana. And they are able to help provide technical assistance to set up these kinds of local programs, to train professionals who don't understand agriculture well, but want to learn how to better serve the agricultural community. And they help set up the various programs, evaluate them, and conduct research that needs to be done and hasn't been done about such issues as suicide. Why is the suicide rate so high among the agricultural population? Are there specific types of farming that are more prone to producing distress, etc.? So that is the background that I wanted to provide, and I thank you all for participating. The last slide has my contact information. If I can be of any help to anyone, please feel free to email me first, and thank you. And I'll take any questions when either now or as we go along.
Thank you so much, Dr. Rosmann. This is really good information there. And now I'm sure we're going to get to the end of the session. We're going to have some questions, but now I would like to move on to our next speaker, Professor Dothaj. Whenever you're ready, you can go right ahead in your presentation.
All right. Am I able to share my screen? Let's see.
You should be able to share it.
Okay. Okay, can everybody see that? Yes, no, maybe so?
Yes.
Yes.
Alrighty, thank you. Thank you, Dr. Rosmann. It is so good to hear your perspective and the work that you've done and and how helpful that has been to farmers, families, and professionals working with farmers. As Dr. Bickle shared with you, my name is Kathy Dothaj. I'm the Education Director for Home and Family with University of Missouri Extension. Karen Funkenbush is the individual who oversees the Missouri Agribility Program. I oversee individuals who work in the field in human development, family science, state faculty in housing, and in PFP. So a lot of different people to work with. Oh, come on. I'm not sure why it is not letting me advance these.
Have you made it full screen, Professor?
It is full screen. And I've always been able to.
If you take your mouse down to the bottom left corner of the slide, does it give you little arrows?
There you go. Thank you.
Yep.
Using the wrong arrows, too many things. Jason, I know why you don't use PowerPoint. We have been, University of Missouri Extension and Extension across the nation has been working with farmers and farm families and other individuals for a number of years. We have been fortunate enough to be able to expand our work through grants from the National Institute of Food and Agriculture, NIFA, and that is an agency of the U.S. Department of Agriculture. Some of the grants that we have are the Missouri Agribility Grant. That's the one that Karen Funkenbush is in charge of. We've had that particular grant for over 20 years, and it helps us to provide education, networking, and direct assistance to farmers with disabilities and their families. We also have the Beginning Farmers and Ranchers. That's another grant that we've had for a while, and then the Farm and Ranch Stress Grant, which are the new ones that we have. So these are, once again, NIFA grants. They're the National Institute of Food and Agriculture. We have a 2019 grant. It is the name of the grant is the North Central Farm and Ranch Wellness Next Steps. We just call it the 2019 grant because that's easier. That we were granted that in 2019. It was to be completed in August of 2020, and we all know what happened in 2020. So we have had an extension, and so that the 2019 grant will be extended to August of 2021. We also have a new grant, the 2020 grant. Once again, the 2019 grant is we work with Iowa. Dr. Rosmann, you'll be glad to know that we work with Iowa. They have the main grant, and we have a sub grant to that. North Central region includes 12 states, and so we work together. Much of the states that Dr. Rosmann talked about when he was talking about the people that he worked with during the 1980 farm crisis. The 2020 grant is called the North Central Farm and Ranch Stress Assistance Center, engaging programs to support producer well-being. And through that is a 3-year grant, and it is a sub-grant or subcontract with the University of Illinois. Through the 2019 and the 2020 grant, we are able to provide a number of programs, and I'm going to share with you some of those that we've been doing. Some of you may be familiar with the mental health first aid. It is an extensive program. It's about between 6 and 8 hours. And there are 2 different curriculums. There's a curriculum for adult curriculum, and there's a curriculum for individuals who work with youth. Before, pre-pandemic, I guess we'll be using that a whole lot from now on. We only did these face-to-face. Now we are able to do them either virtual, completely virtual, or we'd be able to do them hybrid. So some pre-work for individuals and some then not face-to-face. Well, I guess we could do them face-to-face and virtual. Through this program, we help individuals to identify and understand and respond to the signs of mental illness and substance use. The training gives skills that are needed to help individuals coach, provide initial assistance or initial support, and then if there's a crisis, then to know how to refer people to other resources. QPR is a much shorter. It's about an hour or an hour and a half program. It stands for Question, Persuade, and Refer. It is specifically for suicide prevention. And there are these are the 3 simple steps. And once individuals have participated in this, once again, this can be done face-to-face, but most frequently is done virtually. It helps people to recognize the warning signs of suicide, know how to offer hope, and then know how to get help and save a life. These have all been very popular and very well received. Another program is Taking Care of You. Taking Care of You is a multi-session program that was developed by the University of Missouri Extension. Once again, pre-pandemic, it was only provided face-to-face, but now we have been doing it quite successfully with adaptations virtually. Gives practical strategies and experience to help with stress. So it's a stress management program. They explore topics through small group discussions, self-reflection activities. I think one of the highlights or one of the takeaways is to help us to learn how to respond to stresses in life versus react to them. When we react to stress in life, it may not be as healthy as we'd like if we respond in different ways. We have other programs. These are out of the University of Michigan. Communicating with Farmers Under Stress is a program that we can provide, once again, virtually. Those would be for individuals who work with farmers. So they could be feed dealers, they could be farm service agencies, farm bureau reps. Those were the individuals that this particular program was developed for. Then Weathering the Storm, How to Cultivate a Productive Mindset is specifically for to be provided to farmers, farm families, or ranchers. The Iowa Concern Hotline is not new. Dr. Rosmann will know that it's been in effect for about 30 years. It is one that provides a variety of resources. When you call the Iowa Concern Hotline, which has been augmented by the 2019 NIFA grant, they will, of course, look at your phone number. And so if that phone number is a Missouri, appears to be from Missouri, then they would give you the resources from that state. One of the wrinkles with that is if you went to school in Illinois and you live in Missouri, you're going to get Illinois. So we know how that goes. So that has very extensive information on not only on behavioral health, but also on legal and financial implications. So that has been incredibly helpful. Well, I seem to have lost a slide. This one. TelePsychology is we're being able to provide through the 2020 grant. We are able to offer 1 to 5 free counseling sessions to farmers, farm families, and it is provided through the Missouri MU Psychological Services Clinic. This clinic is coordinated by Dr. Deborah Bell, who's the director. It is the system that they use is called Skills for Psychological Recovery for Farm Stress, and helps to strengthen coping skills to manage stress, helps to give strategies for building resilience, and to support good behavioral health adjustment to face of acute long-term crisis. So that has been very helpful, and we have been very pleased to be able to offer that to our farm communities. Okay. We have extensive media presence. We have this website is strong. Show Me Strong Farm Families. So we have the website. It's provided here. Individuals can go to that website and receive information about the resources. We also do a lot of work with social media and Facebook, Twitter, Facebook, Twitter, and Instagram. So those are the kinds of things that we have to offer. So we have lots of information, always doing lots of collaboration, because once again, there's no need to reinvent the wheel. So we are working collaborative with a lot of different, particularly in the North Central region, to provide the best resources for farm families.
Thanks so much, Professor Dodich. That was great. And I'm sure we're going to have some more questions at the end of the session. Now we're going to go right into our last speaker, Mr. Jason Meadows, whenever you're ready.
All right. You guys hear me okay?
Yes.
Okay, perfect. Like I said, my name is Jason Meadows, and I would like to begin by taking the opportunity to thank the Most Policy Initiative for this opportunity to share my perspective on rural Missouri, the farmers and ranchers that we serve, and its strengths, and how we can utilize them to bring awareness to the challenges we face in mental health care. I am a proud rural Missourian, a proud rural farmer. I have deep ties and connections to this community. And today I will share with you a heartfelt testimony of how stigma can shatter any hope for meaningful rural healthcare, and how meaningful behavioral health is lacking in so much of rural Missouri, and how, and I'll take it another level, how lack of access to high-speed internet is a bottleneck to the most remote of us accessing care, especially during the pandemic. It's my hope after hearing my words today that you'll have a much better perspective of what is going on in rural Missouri. So I want to start off by introducing myself and giving a little bit of my background. I was born and raised outside of Cuba, Missouri, about an hour and a half southwest of St. Louis. My dad is a farmer, and my mom was, by the time I came around, she was a stay-at-home mom. She had done many things before that, but that's what she did by the time I'm the youngest of five. My dad had many ventures as I was growing up. He owned the local livestock market in Cuba, in addition to running a large cow-calf operation. When I was about 8 years old, he sold that business and began developing some of our farmland into subdivisions right outside of town. My mother was always there to support in whatever capacity she needed to make all these ventures as smooth as possible. I graduated Cuba High School in 2002 and left for St. Louis College of Pharmacy. I graduated there in 2008 with my Doctor of Pharmacy and came back to rural Missouri to work at a local hospital as a pharmacist. I also continued to run a cow-calf operation of my own as well. In 2019, I recognized the need for more resources among rural Americans and farmers in particular on mental health. My experiences of transitioning from rural life to city life, then back again to rural life with rapidly increasing responsibilities caused me some incredible anxiety. Thankfully, I was able to overcome that anxiety, and I wanted to help others do the same. So in July of 2019, I founded my podcast, Ag State of Mind, to help provide a sound resource for those in agriculture and rural America on ways to deal with their mental health. As of speaking here today, I have released 83 episodes, I believe, in total, speaking with mental health professionals, university extension agents, farmers with their own stories, and many other advocates of a healthy lifestyle, hopefully to bring meaningful and insightful conversation around mental health in rural America. So as you can see, I have a very unique approach to talking about mental health care in a rural setting. For starters, I'm a healthcare provider with ties to rural America. Sadly, so many of the individuals like me who left rural communities to obtain professional degrees, they never return. There's, like Dr. Rosmann saying, there's often no work for them at home, and they instead choose to pursue their careers in urban or suburban areas. And I feel a great sense of pride and gratitude in the fact that I am able to return to my rural area and serve them. And I feel that we need to do our best to help more rural youth find that passion that drives them to come back to these rural communities they've left. I mean, that's something I don't think I really realized was an issue, was so many of these people leaving. And I mean, of course, that's going to deplete the resource pool. And I think one of the things that we're going to have to do is to encourage these young professionals to come back home. And because it's very important for the professionals, not just in mental health care, but in all professions, pharmacists, doctors, lawyers, all of them, to have a sense of what the rural and agricultural lifestyle is, because that is who they will be serving. And that's incredibly important, as Dr. Both, everyone who's here today will tell you, understanding the rural lifestyle as a professional is integral to breaking that stigma and to helping folks understand what needs to be done. I also feel one of the biggest barriers to obtaining meaningful mental health treatment in rural America is, like I said, having any providers at all. And two, again, those who are serving the rural communities being familiar with the rural lifestyle. I'm going to use my own town as an example. Like I said, I live outside of Cuba, which is about halfway between St. Louis and Springfield on Interstate 44. We have the town has a population of about 3,200 people, and it's right on a major highway, Interstate 44. We are rural, but definitely not as rural as many towns in Missouri. But to find a mental health professional, I have to drive to, Raleigh is the closest, and I'm not sure where it is to the east. I'm going to speak about my own journey in just a minute, but just a few years ago when I did seek out a counselor of my own, it became really frustrating for me because I think the first 5 numbers I called were either disconnected or I couldn't see me in a timely fashion. And as many people know, anybody who has struggled with their mental or behavioral health in the past, it's not really something that you want to wait on. It's something that needs to be taken care of, and it can't really wait for 2, 3 weeks, months down the road. I mean, it needs to be something. So I think getting more of these people, more of these providers into these rural communities is going to be a huge thing. So compare this to like my primary healthcare provider, which I can just go in, see a doctor, get a prescription in just 1 or 2 days. I'm not sure that we can just turn it around so fast like that, but I think that should be the goal, is to have mental health care, behavioral health care, like Dr. Rosmann says, as accessible as primary health care. I want to talk about a little bit about my own struggles with my mental health. And growing up in rural America doesn't make it very easy for a young man such as myself to speak out about his problems. Like I said, I just had over 3,000 people in my hometown, and my graduating class, I think, had about 80 students in it. We are all very familiar with one another's business. The stigma surrounding mental health is amplified in these small communities. So as you can imagine, if a mental health clinic would be built in one of these areas, I think it would be incredibly difficult to have someone be seen in their hometown due to the fact of their fear of being seen. So, I mean, such is the stigma of mental health in rural America. But in my talks with several mental health professionals and those who are in this kind of rural healthcare space, there's been a lot of talk of what has been referred to as integrative care clinics, where a patient comes in to a single clinic to seek assistance with all of their health needs. These clinic settings, the patient doesn't feel singled out to be seen by a particular type of provider. The behavioral health provider is in the same clinic as a primary care physician or an internal medicine doctor, nurse practitioners. All of them are together. So what this does is it removes any perceived stigma that may be associated with seeing a mental health care provider, because they don't feel like they are singled out in doing so. As an agricultural producer myself, I have found that the need and talk for mental health care is sorely needed. Dr. Bickle referred to this in the beginning. In 2016, the CDC released a study suggesting that those in farming, fishing, and forestry occupation, the triple F, experience a rate of suicide that was nearly 5 times that of the general population. Those initial findings from this study were actually retracted, but it has been found that farmers and ranchers in America are at significantly higher rate than the general population of committing suicide. So regardless of what the data may actually say, America's farmers are struggling. Rising debt, uncertain trade in commodity futures, increasing friction between consumers and producers are just a few of the highlights of the stressors that farmers are facing every day. And as a producer and a child of a producer myself, I am all too familiar with these stresses. What we need is more real talk of recognizing the struggles in agriculture. And people need to understand that by sharing their struggles with others, they can experience a therapeutic effect just by getting it off their chest. And I think that is the main mission behind my work, behind my podcast, is letting people know that there are others going through the same or similar issues as they are. And when we can realize that we all experience struggles and that our burdens are not necessarily unique to us, we can kind of yoke together. And I'm actually going to go off script here a little bit and talk about an experience that one of my friends had and he shared with me on my podcast. And I've been sharing this experience quite a bit with people. And it was a story that was told to me by my friend Nathan Brown. And he had a friend who came to him and he asked for some help loading some hogs. And turns out that, so let me back up, Nathan agreed to come over to load the hogs, but he realized that this was out of character for someone. This was out of character for him to seek help with something like this. And he recognized that need and he went over there and helped him. And it turns out the guy didn't really need help loading hogs. He could have done that just fine by himself, but it was a great segue into him telling Nathan about some of his problems, some of his issues that he'd been having with his stress, with his family life, with his financial stuff. And that Nathan, who is an incredible advocate for mental health and agriculture, by recognizing the need and seeing that need, he was able to step in there and know what this guy needed. And he encouraged him to go and get the professional help that he needed. And there's a lesson here. And that lesson is that we need to be able to recognize things that are out of the ordinary people, especially among male farmers. They're not going to just come out and say, hey, I need some help. I need some help with my mental health, with my behavioral health, with my stress, with my finances. They do not feel comfortable talking about that stuff, but they do find comfort and ease in asking someone to come over there and help them with the project, like I said, loading hogs. So I think what we need to encourage people to do is recognize these situations, and when these situations arise, that we are able to act and realize that it may be something more than what they originally had asked for. And again, I want to go back and share the success of that story. Nathan's friend actually went and he got the help he needed, and he became a spokesperson for this mental health care clinic in his rural area, and is doing much better, doing really well now. So I always enjoy telling that story and share that story as often as I can. So, and I want to finish here, and I want to share with you something that is near to my home and to many others like mine in rural America. A huge barrier to accessing resources such as telehealth is the lack of reliable and affordable internet in rural settings. I'm going to give you my personal experience with accessing internet at my farm. I talked about where I live. I'm rural, but not as rural as a lot of people. I'm approximately 3 miles north where my house sits of Interstate 44. My internet bill is $180 a month for a satellite internet connection that will get me at most 25 megabytes per second. I can't tell, I don't know a whole lot about internet speeds, but I can compare it to what my friends in town get, and they pay a third of that for 200 megabytes per second. I mean, I'm not a math major, but I do know well enough that is a considerable gap in coverage there. So, I'm very blessed that I can afford the $180 a month, but I know not many people can do that. And this is huge bottleneck for rural residents obtaining valuable resources, like I said, such as telehealth and other forms of, even forms like this where they can access webinars like this very easily. And during the pandemic, when schools were shut down, we saw the need for how important high-speed internet can be. As challenging as remote learning has been, adding in poor internet just intensifies that challenge. And it was nearly impossible for all, I have 4 children, 4 boys, and it was nearly impossible for all of them to be on the internet at the same time due to the lack of bandwidth. Now, I don't know what kind of logistics, infrastructure that it would take to make high-speed internet a reality for all rural families like mine, but I can tell you what a blessing it would be to the lives of families like mine. Again, I want to close here by telling everyone I appreciate the opportunity to address you here today. Again, I'm a very, very proud rural Missourian. I'm a proud Missouri cattle producer, and I believe that real talk surrounding mental health in rural Missouri needs to be a priority. The farmers and ranchers of our state need to have the ability to speak up and be heard. And through breaking the stigma surrounding mental health and access to meaningful healthcare and internet, I believe that we can make incredible strides in making that happen. Thank you.
Well, thank you all so much. I think all 3 talks were incredibly insightful for our policymakers and everyone else who's working in some capacity with rural communities in our state. I appreciate everything that you have to offer. We do have some time, 14 minutes, to answer some questions. So I want to remind, if you're one of our guests, please feel free to type in your question in the Q&A or in the chat. We'll be able to answer those if we have time. I want to address the first question here. A couple of the panelists touched on how important it is to train those who interact with farmers how to respond to potential mental health crisis. And I think Professor Dothage might be able to answer this specifically. Who do you think specifically target to receive these trainings? For instance, do you reach out directly to FSA offices, COPs, or other organizations?
Thank you. All of the above. I think it is such an incredibly important situation and issue. We work a lot with. We haven't talked much about youth. We talk about farm families. Well, in those farm families are youth, and so we have done a lot of work with school counselors because they see the issues with the, as Jason said, the pandemic just adds on more stress for lots of other things also. And so we work with we've worked with school counselors. We've worked with ministers. So I do think sometimes working with more informal systems sometimes can be as helpful as working with more formal systems. Jason talked about how his friend reached out to a friend of his for the resources. He didn't go to his loan officer. Those individuals are important, and it's important that we share that information. But I think that informal networks are also important, that we not that we target those also, or are inclusive of those.
Thank you. Another question that I see here is, has telemedicine increased access to mental health services in rural America? And I would like to ask this question first to Dr. Rosmann, and then I guess both of the other panelists are welcome to jump in as well.
Well, thank you. We really need to focus on the states that do not have adequate bandwidth for telehealth, as Jason was saying, and we need to focus on the states that are highly agricultural but don't have adequate resources to address the behavioral health needs of the agricultural population. I'm really glad that this briefing is aimed at helping Missouri policymakers, elected officials, people who are part of the state government, to address the shortage of appropriate services for the farm population. I think it is helpful to know from Kathy what is going on in Missouri. I believe that a combination of federal funding through the Farm and Ranch Stress Assistance Network and the USDA can help address both the bandwidth issues and the lack of persons who understand agriculture and who serve the agricultural population. Now, it is incumbent upon Missouri people to develop systems or networks that fit the needs and the culture of your agricultural producers. So it is best if you do your own designing of what works. I think what we are trying to provide here today is background information and resources. And I would like to just add to a couple of the things that were mentioned. The Iowa Concern Hotline number is 1-800-447-1985. 1-800-447-1985. The 1985 indicates how long it has been in existence. I also want to call attention to the availability of an article that I sent to Rachel and Eleni. I'm using your first names because it's easier for me if you'll call me Mike. I would like to mention the availability of that article, which I know will be posted online along with the webinar here today. So I am impressed with the candidness and forthrightness of you, Jason, and you've hit the nail on the head. We've got to have providers who understand agriculture, and we need to be training our professionals in this area in Missouri and elsewhere around the country.
That's just an incredible point. Professor Dotthedge, I don't know if you have to add something to this.
Thank you, Mike, for providing the Missouri or the Iowa Concern Hotline number. I will add that to my PowerPoint. So I appreciate you sharing that, and agree fully with that. It is we are working with the School of Medicine and with some other training units to make sure that they understand rural life and rural agriculture. So I think just like we train physicians and other healthcare providers, it's important that we give them information about rural life. And Jason, part of the reason for doing this is what you have talked about, and that's to encourage new professionals and not so new professionals to move to rural communities. The University of Missouri Med School has a rural track that has become very popular. So, but Jason, it's one of those things. If we had the broadband that we all wish, I mean, I drive to my daughter's because I can't get broadband internet at my home. And so that really is a stumbling block for lots of different things. If we had rural broadband, more individuals and more companies would be likely to come to rural areas, thus increasing the tax base.
Yep.
I was also wondering on a personal point, Dr. Rosmann, I wonder if you have seen an increase in farmers or people who need help with mental issues. I wonder if you have seen an increase in telemed in your stations being online. Do you offer that as a professional, as a psychologist?
Can you say that again, the last part of your question, please, Eleni?
I wonder if you have seen an increase in how many patients want to see you over their phones, and I wonder if you offer that option.
Yes, we have seen a significant increase in the use of telehealth and telephone to provide counseling assistance. As Jason was saying, and also Kathy, it works best when you can have the first session face-to-face. And it even works better when that first session is held on the farm where the person resides, because it provides a lot of insight about the kind of background and the issues and the type of farming operation that the caller or the person is coming from. Then telehealth or even the telephone can be of assistance. Unfortunately, in some states, telephone calls are not reimbursed by insurers, and only telehealth, which includes a video portion along with the audio portion, like this webinar. So a lot of work needs to be done to improve the availability of services. As Kathy just mentioned, there is training in Missouri with a track in rural medicine. 14 universities in agricultural states offer a course now called agricultural medicine. It is for students in medicine or residents in medicine. It is for already practicing physicians. It covers all the major health systems. To date, about 3,000 MDs, DOs, nurse practitioners, and others have been, including pharmacists, have completed this course. It is available by contacting the regional centers for agricultural safety and health. Karen Funkenbush, Dr. Funkenbush, will know how to reach these providers that Missouri physicians can access. We needed the same thing with behavioral health care providers, and that's why the new Farm and Ranch Stress Assistance Network is a beginning effort to train people to be competent in agricultural behavioral health.
Fantastic, fantastic. I wish we had hours to speak about this because it's such an important issue, but I do want to respect everyone's time. And I would like to end with a question that directly relates to policy. So when we're thinking about preventing and healing mental health or behavioral health related distresses and diseases for the rural communities, I would like each of you to kind of close thinking of one or two policies that you think could be the most effective, either at the state level or the federal level, both for maintaining mental health, but also reducing these barriers that we talked about in this session, mental health. So if each of you can take, you already talked about it in your work that you do, but how can these really relate to some of the policy decisions that our lawmakers here and our institutions can try and make right now? And whoever wants to start first, that's fine.
I will. I think, and we've talked about this. Every one of us have talked about this, the importance, and I'm not up on policy and what goes into policy making and law making and everything like that. But whatever it takes to get more rural healthcare providers in these rural communities, I'm not sure what that takes, but we need to encourage that and incentivize that as well as we can, because that is what is going to, like I said, it would have been very easy for me to not return to my rural community. There were job offers aplenty in suburban and urban areas. And I chose to come back home because I love it here, and helping to find other people who will do the same, and also incentivizing people to do that. I think that is going to be key into taking this to the next level.
I appreciate that, Jason. A million years ago, when I graduated from college, if you went to a low income school, if you taught in low income school, they began to, over the years, would reduce the school loan that you had. And so I think, Jason, that's what you're talking about with incentivized, that if individuals were willing to come to more rural areas, perhaps some of their school debt could be relieved. That may not be the only thing, but that would be one thing. The other thing is broadband, and that's not just for behavioral health, but that would be increases in the economic base and lots of other things. So.
Thank you. I agree with both Jason and Kathy. I would say that the National Health Service Corps, I think, is the entity you're referring to, Kathy. And when I started off here today, I mentioned that all but one county in Missouri are declared mental health shortage areas available, and they have the capacity then to obtain improved funding for behavioral health care that is provided by people who have professional training. So that is a way to begin the process of building local community programs that provide behavioral health service. I would have to say in closing that I get a great many calls from Missouri farmers who are struggling, and they're struggling because of what Jason says. There's a lack of adequate resources. And it's not just in Missouri, it's in many places of rural America, but it needs to be started at the state level to address these shortages. Thank you.
Well, thank you all so much for being here today. We'll go ahead and wrap up. I will just say I come from a city and went into agricultural research for grad school. And I remember spending so much time on my friends' farms trying to figure out how rural life worked before I went and decided I wanted to research things in that agricultural producers are doing. And so I can really relate to having people in rural areas who understand the rural culture and the importance of that. So thank you all again. That was one of the big takeaways for me, but I learned so much in this session, and I hope that we'll be able to share this recording with others who weren't able to make it. It'll be on our website later today. We'll also include the article that Dr. Rosmann mentioned and links to contact our speakers if they left that information for you. So thank you all again, and we hope you'll join us for our next briefing to be determined. So thank you.
Thank you.
Thank you.
Thank you very much. Have a great day.
Bye-bye.